Hello, everyone. Welcome to the Hormone Helper Podcast. I'm Coach Andrew, your hormone helper from Fit for All Fitness. I personally coach over 1,600 men and women to help better understand their hormones so they can lose weight and get their metabolism back on track. With this podcast, you're going to hear from me and my special guests about everything from metabolism to thyroid to weight loss. And we even talk a little bit of sexy time as we chat to spread more knowledge thick like butter on your hormones. If you're ready to learn, I'm ready to share, so let's do this. Hello, everyone. Welcome to today's episode where we have a very special guest, Dr. Denise Handscomb, with us. She owns and operates Abaton Integrative Medicine in Oakville with her very lovely sister. Dr. Denise is a registered NND in Ontario. That's good old Canada, where we both are from. Now, for those of you who don't know what an ND is, ND stands for naturopathic doctor, and they basically operate as comprehensive support. So they're able to utilize a lot of various modalities using naturopathic medicine to allow for really an individual and custom treatment protocol. So I've had the pleasure of working with Denise on quite a few clients together already, and I knew that she would be the right person for today to talk about a lot of things female. It's crazy because I feel like I talk with women a lot from a hormone perspective, and so many females are like, why are you talking about hormones all the time? So it's kind of great having you on because it actually comes from a female perspective. So I'm really excited. I'm curious as to kind of what brought you into this field to start. Like, you could have chosen so much in the healthcare field. Why choose to become a naturopath?
So I grew up with naturopathic medicine, so my family was always involved, and I saw a naturopath actually when I was young, and I just saw the benefits that it provided my family. My mom was diagnosed with MS when we were younger, and she had been going to the regular conventional medicine to get answers, and she wasn't feeling better. She wasn't getting answers that she was hoping for. So she sought out a naturopathic doctor, integrative medicine approach to coincide with her conventional medicine team. And she found a lot of improvements on that front. Got a lot of answers, started to feel better. So I just kind of grew up with that. And then I always wanted to be a doctor. So when I was starting to kind of get my stuff ready to see what I was going to study, where I was going to go, what my next steps were, I kind of naturally gravitated toward naturopathic medicine. And I did I was a receptionist actually at an integrative clinic where there was a medical doctor working with two naturopathic doctors. Mm-hmm. Yeah. So I got firsthand that experience of that integrative approach, which I think is one of the best ways to practice medicine when we're all working together. So after that experience at that clinic, I was like, no, I know naturopathic medicine is the right path for me. And then I started the process of becoming a naturopathic doctor. And here I am today, 7 years in.
That is phenomenal. I feel like at some point, whether it's like you're a coach, whether you're a doctor, like at some point you went into the healthcare field because there was a struggle that you overcame. And then you were like, now, like, this has become a passion, right? And it's interesting you say that naturopath covers so much more than just a hormonal perspective, because I feel like a lot of people, they hear things like naturopath and they really don't know like what it is, what do we do, stuff like that. So besides just hormones, and I know it's kind of like throwing kind of a blanket over everything, like, who are the type of people that you see day to day? What do people kind of come to you on the regular with in need for their health?
So we see a lot of family medicine. So we start with kind of usually with the children or one of the family members, and then it kind of extends to the rest of their family because they're noticing improvements. They're seeing that they're living a healthier lifestyle, and that kind of extends to the family. So some of the main things we see patients for are digestive concerns. So from like IBS type symptoms, constipation, bloating. I see a lot of eczema as well in children, childhood eczema, food sensitivities. And I do see quite a few males as well for cardiovascular health. So whether it be cholesterol issues, high blood pressure, that type of support.
Interesting. Okay. And it's good to know that women, and for those men who are actually listening in on this podcast as well too,
Yeah,
men have hormone issues too. Men go through health
yeah, they
stuff as
do.
well. No one is
Right.
immune.
Talk about that.
No one is immune. It's like
No,
you can be targeted. So
no, everyone has hormones, and they're just in different types of hormones and different levels for male and female. But yeah, everyone has hormones, and they all can play a role in health.
yes. So I'm really excited to get down to kind of the nitty gritty, because I feel like it's time to talk like basically all things like female changing, like post
Yeah,
pregnancy and post menopause are kind of, um, I guess, the most common changes that women go through, but it can be super overwhelming because they're really not taught what to look for. Like when I'm speaking, at least with the people I'm working with, a lot of people are just like, I just had a kid. Nobody told me nothing. They were like, you're fine. You may do like blood work once a year. You're okay. And same thing like menopause. They're like, hey, it's life. You're changing. I don't even know what that means. You're changing, right?
yeah,
So like as someone who sees both like pregnancy, we'll start with kind of with the pregnancy first, like pre and postnatal,
yeah.
and encounter that. Like how come there are a ton of women that don't really have a good idea of their hormonal profile? Like, why isn't this something that's openly talked about in terms of having an
Yeah, and
understanding?
I think that yeah, I think it comes to light too for many patients or many women when there is an issue or a barrier to where they want to go on their healthcare journey, or if they're struggling with fertility, or they're noticing symptoms based on their hormonal profile. Like I think that's when our society is based on, okay, I have a problem, I want to fix it, versus kind of looking back and maybe fixing it before or like addressing it and supporting it before the problem arises, right? So I think it's just also our society. There's almost a disconnect between how they're feeling, and they're busy and they're, everyday life. They're not thinking about how they're feeling. They're not connecting with their body. So I think there can be a bit of a disconnect there. And then once they kind of look into a little deeper, think about, I'm feeling this way for so long. They talk with a couple friends, and they start thinking, oh, hormones is something that I can, maybe it's that. And they don't even know what that means. It's just blanket hormones, but they don't know what it means. Like everything interacts, right? And hormones affect other hormones. So it's kind of just that education piece. And that's why that's one of my favorite parts about being a naturopathic doctor, is that education piece and teaching patients what to look for from a preventative point of view, what parts, like what symptoms they may be experiencing, and how they're all connected. Even from a digestive component, like your digestive health will greatly impact your hormonal health, and just kind of making those connections for patients so that they understand why they're feeling the way they are, and that they can be more mindful and aware, and then maybe address some of those symptoms or some of those imbalances before they become more
Mhm.
chronic.
It's crazy when you talk about putting it under kind of like that blanket, like maybe it's hormones, right? Like they have a bunch of issues and they're like, yeah, this
Yeah.
is kind of like the
Hormones.
last ditch effort. And it's not something like you and I live in Canada, but it's like I work with a lot of clients in the States that it doesn't really matter really what side of the border. It's still an issue where
Yeah.
like you'll go to a doctor, they'll measure you in a range. You and I both know that this range is
Mhm.
giant. It covers 16 to 75. And if you're somewhere in the middle, you're fine. You're deemed it's not something that we need to address, but it's not really an optimal solution to just kind of be
Absolutely. Yeah.
mid-range, right? Now,
And also, yeah, even from like a fertility perspective, there are, like you mentioned, optimal ranges within those larger ranges that you want to be striving for to support fertility, and that's not always talked about.
yeah. Now, before
Mhm.
people search for the hormonal solution, these
Mhm.
women that you're speaking to from pre and postnatal, looking to be able to have children and want to optimize this, like what are they doing prior to coming to you, or are they doing anything prior to coming to you and maybe it's just not working? Like what does that look like?
So yeah, so definitely I do have patients who would come to me already trying to do some things on their own based on Googling or talking to friends, that I will commonly see. So that can be, I mean, sometimes they pick the right thing, sometimes they don't. It can be dangerous in the sense that they may be targeting different hormone pathways, detox pathways, or different hormones than they should be targeting, and that's either going to lead to worsening of symptoms or not doing anything. They don't feel any different. So I do see both of that. I know that a lot of women will, especially before coming to me, will kind of have some type of baseline where they want to go. Just again, I think it's mainly based on like Googling, okay, I feel this way, what could it be? And then they say, well, I think I have an estrogen dominance, or I think my thyroid's not working well, or that kind of thing, right? So they have an idea, and then based on what we talk about in our initial appointment, I'll kind of break it down for them, and then I definitely will always recommend some type of testing to kind of get to the root and kind of see where they're at, whether it be blood work or additional like third party testing for hormonal support and things like that. But a lot of women will come to me and be like, I don't know, I think it could be this because I saw it or my friend mentioned it, but I don't know, right? So then that's where we kind of do that investigative work to really get to the root of it. Because like I said, there's so many, all the hormones are so connected that you really need to make sure that you're kind of looking at the whole picture in order to really get to the bottom of what's happening.
And I mean, like a lot of, I guess we can kind of like openly state this out there too. Like a lot of people feel like they have to go to Google, not because their doctor's like doing a poor job, but really it's really out of the scope of what a GP or general practitioner really does, right? A general practitioner is there for your standard cold, your flu, you might need an x-ray, but like they're general. That's exactly what they do. They refer to other people. And if they, they think that something is wrong, they will go and they'll tell you to go and see a specialist. So it's not really something that I feel like they take a really close attention to, that they need to be able to actually make decisions on that.
Yeah, and I think another aspect of that too is the education piece. The way our healthcare system in Canada is set up is that they don't have the time to provide that education. And I think that's a huge part of it, because a patient needs to understand, one, why they're feeling the way they're feeling, having it explained to them properly, because that also empowers them to make those changes and to implement that support that may be needed. Because if they have no idea why am I taking this? I have no idea what's happening here. Like it's harder to follow through and implement that into your lifestyle when you have no idea why you're even doing those things. So I just think that education piece is the part that's lacking, which I think is really important. And this is why podcasts like this are so important, because we need to educate patients to empower them.
Yeah. I guess one of the common things is like people, like you talked about it quickly. You said estrogen, like my estrogen might be off. I feel like, people know kind of the general buzzwords, right? And the health industry's done I don't know if a good job in marketing, but it's like your health, your estrogen, your thyroid, and your cortisol. That seems to be the three that people are like, I know the word, but I don't know actually what it does, right?
Yeah, or they key in on those sex hormones like estrogen, progesterone, testosterone, those ones, right? But those are just 3 hormones. There are, and like even estrogens are like so many different types of estrogens. You need to know what pathways that your body is eliminating them through. Like there's a lot to hormone support that needs to be looked at, and even like hormones in general, like thyroid's a hormone, your insulin's a hormone, you have hormones for sleep, you have hormones for stress, you have hormones for like feeling full after eating. Like everything our body does is based on hormones, and they're all connected, but we don't really think of it all that way, right? We just think hormones are like estrogen, progesterone, testosterone. That's it, right? They don't think of those other ones as how they can impact their health.
Exactly. When I chat with our clients and I tell them like your hormones are like your operating system. So it's like you can do all of the good stuff. And I'm sure people you work with are like, they're eating pretty decent. They're doing the majority of the right things, but they're still not seeing the changes that they need to. And it's like, well, you could have the newest, shiniest computer, but if you're running Windows 95, like you're going to be in a tough spot. And that's kind of where the hormones come from. But, I guess for people who just kind of go about their days and they're living and everything is just kind of cruise control normal, like, and they don't pay as much attention, like, why should people manage their hormone levels at all? Like, why can't they just let it coast and kind of maybe sort itself or fix itself out?
Yeah, that's a good question. And it kind of comes back down to how everything's interconnected. So other hormones are going to affect other hormones. And if you let those go and not address them, if there's an imbalance, it's just going to be, again, cycles upon cycles of imbalances. And then you're going to notice maybe even not right away, but down the road, more symptoms and things like that. So, for example, if your insulin levels are high, so insulin resistance, you're not able to take glucose into the cell, you become insulin resistant, which that glucose then is sitting outside, not getting into the cell where it should. That can then affect your level of testosterone and estrogen. So you can actually have an increase of testosterone, decrease in estrogen, and that will definitely affect your cycle. That will affect fertility. That can lead to those PCOS type picture or symptoms. So like just right there, that insulin hormone affected a whole other set of hormones and whole other
Yeah.
systems. So I think it's really important that people understand that and address some of those imbalances when they're not on the chronic side, when they're first
Right.
starting, so that they prevent those other more chronic type of issues from occurring.
Not every hormone can correct itself. And I think if people
Right.
understood that out the
Yeah.
gate, that you can do, I wouldn't say permanent damage, but you can do a severe enough change that it's going to be something that you have to
Mhm.
actively work on. And just like it may have
Mhm.
taken months or years to be able to get that hormone progressively bad as it was, it might take the same to be able to reverse it. And I think people have to have that
Absolutely.
expectation of the hormones going on. Now, I mean, from a pregnancy perspective, like it's amazing to me how a lot of people
Mhm.
just go through pregnancy. Like they don't pay attention to their cycle, they don't really
Mhm.
understand how their hormones change. What should
Yep.
someone who is looking to go into a pregnancy first, what should someone be
Yep.
looking for? What should someone be trying to do to make sure that their
Yep.
hormones line up as much as possible?
Yeah, so I get a lot of women coming to me before they, like maybe about 6 months to a year before they're looking to
Okay.
conceive, to kind of get their bodies prepared and ready. So there's a couple things we look for. So, and I'll just kind of
Mhm.
list them out for you. So some of the ones we will test. So I'll usually test these certain tests by a blood test. FSH and LH and estradiol. So LH is your luteinizing hormone that helps your egg get released from the ovary when you're
Okay.
ovulating. FSH helps stimulate the growth of the egg, and estradiol is your estrogen levels. Or one of the estrogen levels, and those three will be tested on day 3 of your cycle. That gives me a good idea of your ovarian reserve, your ovarian health, the health of the egg quality. If there's like a PCOS type picture, the ratio between that LH and FSH is very important. Then we also look at progesterone levels because progesterone will help maintain a pregnancy. So we want to check those to make sure that they're high enough. So if the woman did become pregnant, she's able to maintain the pregnancy. We look at insulin as well, because as I just mentioned, insulin, if it's too high, can cause lower levels of estrogen, higher levels of testosterone, can really affect that balance that you want to have for conception. And then we also check, and the progesterone also should be done around day 21 of your cycle. So it's that other educational piece of there's certain tests need to be done at certain times in the cycle for best results. Otherwise, they're not as well. I can't interpret them as well. And really, I kind of always have to redo them if they're not done on the proper
Okay.
day. And then thyroid's another big one. Thyroid is huge. So again, if your thyroid is supporting a lot of different like regulator
Mhm.
systems. So if your thyroid is not balanced, you can have again trouble with conception and then also maintaining pregnancy as well.
So there's a lot of
Um,
facets that seem to go in that. I want to kind
yeah.
of break it down a little bit. So let's talk about that,
Mhm.
the LH, the FSH, and the estradiol. Are these things that a
Yeah.
standard doctor would check? So someone's going into the pregnancy, would they be like, okay, let's look for these? Or are these things that actively as a naturopath, you're like, I want to see these specific levels?
So it's kind of both. So yes, definitely from a conception, like a fertility preconception
Mhm.
point of view, I will always test these markers. Um, Typically, again, if there's any, usually conventionally they'll be tested if there's some type of period irregularities or fertility
Mhm.
issues currently, then they'll definitely take a look. Like it won't be as part of like a general workup preconception
Mhm.
conventionally, but definitely for me, I usually will kind of check in on these values if the patient's coming to me looking for preconception support.
Okay. Now, after they've gone through that process, you talked about making sure that it was specifically done on a cycle day.
Um,
I have
yeah,
yet to come across a single woman who does not track their cycle. Maybe you come across people who don't, but every woman seems to be pretty conscious of tracking their cycle. Why is the
yeah,
cycle time so important for this, for the whole pregnancy part, for the ovulation, for things that's going to help
yeah.
benefit their hormones?
So different hormones are going to rise on different days of the cycle, and they're doing different jobs, right? So it's normal for that to happen. So on day 3 we have our FSH, LH, and estradiol. Those are the best times to test those. And then day 21 would be after ovulation. So that's when we want to be checking around ovulation, and after we want to be checking for progesterone levels, because that's when the progesterone will be at its peak time as
Mhm.
well. So there's different times in the cycle. In order to get an accurate value of what that hormone is doing, you want to test it on that day of the
Mhm.
cycle. Now, you just want to be mindful though. So I know women will often track their cycles in an app,
Okay.
and that's good because, for example, day 3 of your cycle. So the
I didn't
first
know
day of
that they have
bleeding is day
apps
1.
for that. They have apps for cycle
Yeah,
tracking.
they have access to that. They
Interesting.
do, yeah.
Okay. Do
And
you
I
know
would
of any? A
recommend,
shameless plug to an app cycle tracker.
yeah, I do. There's quite a few actually. Like one is that Flow,
Okay.
FLO. That's one.
Makes sense. Good
Um,
name. Good
so
choice.
yeah, right. So that, for example, is good in the sense that you're kind of becoming more aware. So and I like that from knowing when like how long your cycle lengths are and
Mhm.
things like that. So the first day of bleeding is day 1 of your cycle. You'll start tracking that. But what I always recommend too, if we're specifically looking to look at hormones, and I want to make sure I'm getting accurate day 21 reading, things like
Mhm.
that, I usually will recommend using ovulation strips.
Okay.
Um, Starting about day 4 to 5 of bleeding, so day 4 to 5 of the
Mhm.
cycle, so that we can know exactly when your LH surge is what increases right before you release an egg. Okay, so that's the hormone that will go up right before an egg is released. In order to catch that, because then I will count 5 to 7 days after that, and then that would be around ovulation time.
Wow. So that's
Sorry,
pretty in
the post.
depth for it to be like
Yeah,
it's
yeah,
got to be right on the mark for it to kind of see.
yeah. So like you ovulate about like 24 48 hours, let's say, after that peak, and then we want to count 5 to 7 days from there to get the proper progesterone levels. So um yeah, I will typically have women do that when they're doing a Dutch panel, which is a more in-depth urine hormone
Mhm.
test, or even when they're doing day 21 progesterone levels, just to make sure that I know the woman's ovulating and that there was an LH surge and that we saw that. And then 2, to make sure that we're testing all these hormones on the at the proper times to get accurate
Yeah.
results.
Now, for those of you who don't know, a Dutch panel is essentially like kind of a step more like blood work is like a screenshot in time, right? Like you can take a picture beside a home and then turn around the house be on fire and be like, what happened, right? Like a Dutch test, I really like the fact that you brought that up. I've actually have had several Dutch tests through you, and they're a really great way to show how the hormones have converted over the span of a day or a few days so people can get an understanding of what is happening to those hormones. Not just that they're present, but are they doing the right things? Are they converting the right way? Are they actually, is the system functioning the way that it should? And I feel like that should be a
Right. Yeah.
standard kind of across the board, but a lot of doctors don't use that.
Yeah, it's looking at how your body's metabolizing those hormones, because that plays a role on how we then, based on what the patient's presenting with, we will then implement support around what we see. So, for example, estrogens. If they're not metabolizing their estrogens properly, then it breaks it down, the test, for
Yeah.
example, into many different types of estrogens, because there are many different estrogens, but there's certain ones being tested on the test. And I can actually see the different pathways in the liver that we need to maybe support more, to help support elimination of certain estrogens and things like that. So to be more protective, maybe we want to be support the protective estrogen, eliminate some of the ones that are more, that can be more, that can cause DNA changes and things like
Mhm.
that. So it gives me a snapshot into how your body is metabolizing those hormones, so I can better support the body, versus just looking at the value on blood work. Like that's valuable as well, because that gives me ideas and where I like it supports
Mhm.
treatment, but it is a really valuable piece to add that metabolism piece in.
Absolutely. And I think the reason why there's
Yeah.
such a hyper amount of testing from the beginning is really because the ability to conceive and then make sure that that child continues to grow without a miscarriage is the kind of objective that I've understood through that. I feel like that
Yeah,
is a
definitely.
um, high chance that people don't really talk about. It's still really common
Yeah,
that
no,
people miscarry all the time,
yeah.
and and
Mhm.
from a hormonal
Yeah.
perspective, that plays a big role in whether or not that child continues to grow.
Yeah, and there's again, yeah, like, miscarriages can happen for many different reasons. But definitely, if there is a history of miscarriage or that we're seeing signs of a miscarriage, there are certain hormonal tests we will run to see what's going on. So progesterone is definitely one of them. I will always run because even if just low progesterone can also lead to miscarriage as well. So that's something we want to make sure is being
Okay.
monitored. And then HCG is one of the is what actually the pregnancy hormone that's released from the
Mhm.
placenta that helps. It's released into the blood and urine, and that's what you test for to confirm a pregnancy. That's another one that we look for when a woman becomes pregnant. We monitor that. So, yeah, there's lots of different changes that occur when a woman becomes pregnant, and there's definitely hormones that we can look at and additionally support if need
Right.
be.
So essentially, so pre-pregnancy, you're checking the ovulation cycle, you're making sure that you're hitting it on those specific days, and that the hormones are prepped to be able to like carry a child and keep that. Now, once
Yeah.
the mother has gone through the pregnancy and they've had the child, a lot of people don't realize this, but like the hormones don't necessarily revert back to where they should, right? Ideally, in a perfect world, that would happen and everything is fine, right? But what do you find happens after the pregnancy in which someone's like, oh, my hormones are still out of whack or something is not normal the way it was before?
Yeah, so that's actually a big one. Postpartum support is lacking, very much so. Um, Again, the education piece, women don't really know what's going on. So you get those so right after you deliver baby, you're getting a drop in your progesterone and your estrogen. It's a huge drop. So that huge drop can affect a woman mental, emotionally, getting those postpartum blues, postpartum depression. So that's definitely something to help to support the woman through and like education's great, making sure we're monitoring those levels.
Mhm.
If they're noticing more severe mood changes that aren't relieving, it's important that they ask questions. They ask their medical provider for some guidance and support. But we're also noticing too postpartum. Another big one that I again isn't always followed but should be is thyroid. So your thyroid health can shift greatly after you have a baby. Now it can just happen just naturally because having a baby is a big deal for the
Mhm.
body. We see hormone shifts and thyroid health quite often actually. So usually I recommend about 6 weeks after having a baby. If you're feeling up for it, we make an appointment and we kind of check in on all those values. So thyroid values, you want to make sure from a nutritional perspective you're balanced because selenium and iron, all of those are going to affect your thyroid health. And if they're very low or you lost a lot of blood during delivery, that will affect thyroid health as well. Huge stressor will affect thyroid health. So definitely making sure that nutritionally you're being supported. That's why I always say for women to continue their prenatal vitamins, even postpartum. Not only is it going to help support, again, their thyroid, their hormonal balance, but also to lactation if they're deciding to breastfeed. That's also going to be some extra nutrient support to help support breast milk production as well as support the baby through the breast
Yeah,
milk.
nutrient deficiency does not help. It's not in anyone's favor. So it's like making sure
No,
that your
not at all.
nutrients going in and you're
Mhm.
intaking as many whole organic foods as possible. So then that way you can keep those nutrients high.
Absolutely. Yep.
That's huge.
Hmm.
I feel like when people are coming off the pregnancy, the initial thing is like all of the symptoms that you talked about, from like the postpartum depression that people can experience, the higher levels of anxiety, like those are all the kind of like secondary symptoms that come up. I think the main issue which people kind of struggle with is the thyroid for sure. When they talk about having that chronic fatigue and they're like, I'm literally burnt out, which, we both hear all
Yeah.
the time. But also, too, people have this inability. They're like, okay, so I lost the baby, but I still have this weight. And I thought that it would
Mhm.
go with the baby, but now it's not. And it's
Right.
here.
And,
It seems like
and
it's
there's a
here to
lot
stay.
and there's a lot of factors too that will play into that. So then you have, like, so having a baby is a big change, right? Not only is it a change like physically on your body from the perspective of you just gave birth, your body has to heal, but you also now have changes in your sleep, you have changes in your eating pattern. If you're breastfeeding, you have that also to focus on, and that's a different change hormonally for your body as well. So there's a lot of different changes. So that alone is stressful for a person, stressful in a family unit. So that will affect cortisol levels. Then you're going to affect your thyroid health. Naturally, can become affected just from the birthing process, becoming pregnant. Nutritionally, if you're depleted, that will affect those again, right? You're not sleeping as well as you should be because you got your newborn baby who's possibly waking up well, most likely waking up in the night.
Every 3
So
hours.
you're not getting that, right?
It's
Yeah,
crazy.
you're not getting that sleep that your body needs for that recovery. There's a lot of things that happen when you have a baby that can lead to changes in weight for sure. When the woman feels like, she feels like she's not feeling like herself.
Mhm.
Yeah.
Yeah, so it's so important for the ladies listening to be able to make sure that at least from that 6 months prior to having a child, you're sorting your hormones out so that your child has the best chance of being able to grow and develop properly, and then
Yeah.
post
And
making
then,
sure that
and then,
they're checking with you so that way their hormones aren't scattered or they're returning to at least somewhat normal levels transitioning on.
yeah, just so before, like, we just kind of do a check-in to make sure that things are balanced and where I'd like them to be from an optimal fertility perspective, conception perspective. And then we're also supporting nutrient wise in that time as well before conception, about 6 months to a year. We'll implement, like, I recommend starting your prenatal vitamin, getting things kind of ready to go, so that you're ready if you do become pregnant. And then, like I said, yeah, postpartum, the minute you're feeling up for it, we kind of do a little check-in on your nutrients, your iron levels, your thyroid levels, your B12, your vitamin D, all those things, because all of the things are going to help support your stress levels, your sleep, balancing your thyroid, things like that. So we just want to do, again, another check-in once the baby's there and here, just to make sure that you're living as optimally as you can.
Yes, stressors are huge, and people don't understand that stressors
Mm-hmm.
come in many forms: physical, mental, emotional. Body registers it the same way. It's
Yeah.
still a hormonal tax, and it's important that people manage
Yeah.
that. So I think that's,
And even like previous stressors can affect you more long term too. Like even stressors that happened even a year or so ago can still have an impact on the body even today.
yeah, it's huge. And this is why, like, I feel like health is a combination of like finding your own baggage and dealing with your baggage, and then also like
Yeah.
dealing with your health. Like it's like if you can do both successfully, it's like you're gonna be fine. So
Yeah.
we've talked a lot about pre and postnatal, but I think the secondary change which a lot of ladies go through is menopause, or monster pause, as one of my clients calls it, because she was like, I was a she's hilarious. She's like, I was a
Yeah.
troll when I went through menopause. Like I feel like menopause, like when it starts, your GP is like,
Mhm.
hey, this is a normal start to your cycle, everything changes, and then like after menopause ends, they're basically like, you've changed. They don't tell you what you've changed
Mhm.
into. They're just like, you've changed, right? So
Mhm.
what
Yeah.
is exactly menopause, and do all women go through it? Why do they go through it?
Yeah. So menopause, by definition, then is the um, absence of your period for 12 consecutive months. So there's a lot of
Okay.
so there's a lot of variation in so the first part, so I'll break it down. So pre-menopause would be any woman before they've gone through
Okay.
menopause. Perimenopause usually starts back in like it kind of depends. Ages are, I don't like to go by ages because it can happen at any different, not everyone follows that, but some women will start to notice in their
Okay.
40s they're going to they're going to notice those perimenopausal symptoms. So those are the start of maybe the hormones shifting a little bit, so they might start to see symptoms. So trouble sleeping, irritability, hot flashes, night sweats, vaginal dryness, low libido, and changes in weight distribution.
Okay.
So we'll usually sort of see that maybe somewhere in the 40s, maybe early 50s.
Okay.
And then menopause, again, like I said, by definition would be that time where you haven't had a period for 12 consecutive
Mhm.
months. So like some women will even go like 10 months not having a period, have a period at 10 months, and then they're not in menopause by definition yet.
Interesting.
They're
Okay.
still in that perimenopausal time. And in that perimenopausal time, a lot of women will notice even changes in their cycle. So their cycle will be regular. They might have heavier periods, they
Interesting.
might have really light periods. So it's kind of a large window of change. And ideally, we want to support that woman again more in like like early 40s before they start to notice those shifts and
Yeah.
changes, so that when they do start to have those changes in their hormonal levels, like their estrogen, progesterone, they're well supported to adapt to those shifts. Or if they're noticing there's a lot of symptoms around that, we can kind of come in and say, okay, what's going on? Let's take a deeper look and kind of support them that way. Because like estrogen, progesterone are the main ones that we think about too that are going to start to decline. Those are the ones that are going to really start to affect your memory, your cycles, hot flashes, things
Yeah.
like that. So we want to help support you. And after you go through menopause, your adrenal glands are really what takes over for your progesterone production. Like your ovaries stop making your estrogen, progesterone. Your
Interesting.
adrenal glands have to take over for your
Now, people
estrogen,
always ask,
progesterone.
like, is my estrogen become zero at that point? Like, is it basically non-existent, and then it's the other hormones take over, or is it very minimal that changes after
So it will
menopause?
drop. Yeah, so it drops to a certain level. So there's certain values on blood work that you would take a
Mhm.
look at and say, okay, yeah, that's a postmenopausal estrogen range. Like again, the range is a little bit
Yeah.
larger. So women can be in that postmenopausal range, but again, like I said, they may be experiencing symptoms. Even like a small shift in the estrogens can cause symptoms for some people.
Mhm.
So their estrogen won't go necessarily down to zero. That's where we want to focus on that adrenal support so that there is some support
Yeah.
there. Now, even like there is some estrogen production, you want to make sure that your adrenals are well supported. And then we also sometimes, again, depends on the patient and what they want to do and our goals, but there is the use of the bioidentical hormones that we can implement postmenopausally or in the perimenopause, like once they've gone through menopause or even a little bit before, whether
Mhm.
they're in that perimenopausal state where we can bring in some progesterone or estrogen support as well. But then again, we take a look at the blood work first, decide, and then
Yeah.
we go from
And I
there.
think that's a huge benefit to being able to work with a naturopathic doctor. And as someone who, like, medication definitely has its place. Like, medication exists for a reason because there are people who are deficient and stuff. But having the ability to be able to replace some of the hormones that are lost, because there's only a limit as to what people can do naturally through food. Like, there are certain
Yep.
values that you can change. You can implement foods that help, balance estrogen levels. You can have higher amounts of zinc, which can
Mhm.
help increase testosterone, but it doesn't replace things. And when you're truly deficient
Right.
in something, being able to have a tool to replace and know that, like, you can go to a naturopath and be able to have that option is huge, because there are a lot of people who are truly at that deficient and really low level that need that boost and that replacement.
Yeah, absolutely. Like even from a protective point of view, the supporting estrogen, progesterone values is great. Like estrogen in particular, certain estrogens can help support bone health, and progesterone can really help a woman who's postmenopausal get some good rest,
Yeah.
get some sleep, help support that anxiety that also increases with lower progesterone.
Yes, the hot flashes. Can we talk post menopause
Yeah,
issues right now? So, hot flashes,
yeah,
the inability to sleep, irritability, high levels
yeah.
of anxiety, all of that
Low
is,
libido.
yeah, are causes of essentially the lack of, from my understanding, the estrogen being incredibly low, right? That's kind of the main factor.
Yeah, and
Mhm.
progesterone too.
Yeah. So,
Yeah, progesterone can cause those really low progesterone. And sometimes what I typically will do from a bioidentical perspective, I may start with progesterone alone
okay.
and see how much is supported even just with
Mhm.
that. But then if the person has a predisposition for like osteoporosis, or I notice on the Dutch panel there's 16-OH estrogen, which again helps support
Mhm.
bone, their DHEA helps support bone. Like if I'm noticing those are on the low side, I may recommend, okay, some estrogen support might be beneficial for
Yeah.
you, from a bone perspective, from a cognitive perspective. But yeah, definitely that lack or that drop in estrogen and progesterone are going to be things that you're going to definitely notice. And what are some of the reasons for the symptoms, some of the main reasons for the symptoms you're experiencing. But insulin is another big one. Insulin resistance will also affect those
Mhm.
hormones. So that's another one I will always check from a postmenopausal or perimenopausal or any age really, we check insulin levels as well.
Yeah. And that's, I feel like once people go through, because I feel like for women, the majority of the struggle with their body confidence issues, with their weight, with the way that they're feeling symptom wise, kind of happens from that like mid for like when basically when menopause starts to when menopause ends is where they see the most physical changes within themselves. Some of them lose
Yeah,
a ton of
and
weight,
that's their
some
body.
of them gain, and
Mhm.
it's really their body, what it sounds like, is compensating for these hormonal highs and lows, really.
So the body's going to try and hold on to the estrogen it can, and it can store it. So that's why you'll see a change in body composition as women will go through menopause, because their body's trying to hold on to the estrogen that they do have because it's low, and it'll store it. And that's why we'll see it typically on the midsection as well, because their body's like, oh my gosh, I'm going to reserve mode. I want to store that estrogen and keep it because it's low. So that's where
Hmm.
estrogen support can really help with
Right.
that.
And I don't think that a lot of people realize that estrogen is stored in body fat. People don't know that. People just
Mm-hmm.
think that that fat is just excess tissue. And it's like, no, it has a purpose. You
Yeah.
talk about it being used
Yeah.
for energy. That's
Mhm.
what the body does, you know? Now,
Yeah.
like, I mean, a lot of women kind of listening to this and looking at all these hormone changes are probably thinking to themselves, like, this is BS. My husband doesn't have to go through any of this. Okay. Men
Yeah.
technically, though, do have a form of menopause. They do go through
Absolutely.
changes like this. It's just not as
Yeah.
cyclical or extreme, right?
It's not as quick, so it'll happen over maybe a longer period of time, and it won't be as looks as obvious. But if you really look at it, it is still happening too. Like, and males also have estrogens as well. Males have all the same hormones, just at different levels,
Mhm.
right? So, um, typically people call it andropause. I don't know if anyone's heard of that before, but essentially as a male ages, they will have lower levels, like their levels of testosterone will decline with age.
Mhm.
So this will affect their sleep, this will affect their mood, this will affect their weight, muscle mass, they may lose muscle. So they definitely go through changes as well, just as women do, but it's not as quick. So it's more gradual over time. So it doesn't look the
Mhm.
same. And there's also not, they don't have a cycle that they're not having anymore either, right? So it's not, again, like you said, not cyclical in the sense that they're not have like, there's not as much of a
Right.
change from
Yeah. So,
like,
from a
you know what I
female
mean? Yeah.
perspective, basically, those women are cycling their hormones through each and every one of their
Yeah,
periods.
every month we'll have our mother. Oh, I didn't get my period, or did I get my period, or you know what I mean? So men don't have that like every month there's something going on. It's more over time. The testosterone will decrease, things like that. So then they'll notice those shifts over a longer period of
Yeah.
time.
Yeah. So don't worry, ladies. Men suffer too.
Yeah,
You will outlive us
they're
in the
still
long
happening.
run, and then we just die. That's
Yeah,
it.
yeah,
Then you take our
yeah.
money. That's that's the way it works.
Yeah.
Okay. Now I always like to leave kind of the end of the day. I want people to be able to get some. You shared a bucket ton of knowledge, and even things that I didn't know. Like I didn't know that menopause ended, or basically you're officially through menopause when you've had a full 12 months without. I didn't know that there was a date to that, so that's good to know. So what are some
Yeah.
things that they can do to manage these changes? If you would give, like, 3 or 4 tips that these ladies could do to help manage their hormones to keep them stable through these processes, what would you recommend?
Yeah. So definitely stress management is important. So making sure, like whatever that looks like for you, again, everyone's different. Everyone has different stressors and different ways the stress affects their body. So getting that supported is really important because, like I said, your adrenal glands are what's going to kind of take over for you once you've gone through
Mhm.
menopause. And I know that women who are more stressed out may experience, I just in practice have seen it, and it's more like women who are more stressed, or who have unbalanced cortisol responses will have more symptoms when going through menopause, or they may be exacerbated.
Okay.
Because like I don't know if people know, but like even in other cultures, sometimes a lot of cultures don't even have menopause, or they have it in the sense that women stop cycling, but they don't have the symptoms that we
Interesting.
like, that menopausal symptom.
Okay.
Yeah, and it's basically based on our environment, the food we eat, how much exercise we're getting, the stress we're experiencing, our environmental exposures. All of those things are going to affect how our body transitions. So one, definitely that stress piece is important. Balancing blood sugar is really
Okay.
important. Even the smallest insulin resistance can cause definite changes in your hormones and how you're feeling and how you're managing your hormone elimination and how you're storing things. So it's really important to get that checked. I think that should be part of everyone's yearly, or whenever, not yearly, but whenever they're getting physicals, I think it should be checked yearly just to make sure it's staying balanced. So that's your insulin, your fasting insulin levels. Regular movement's really important. Like, again, it doesn't have to be some crazy exercise regimen, but movement not only is going to support that blood sugar, but support elimination, support stress response, get blood flow moving. Like, it's super important just to move. And then checking the foods that you're having, reducing processed sugars. Like, I'm sure, Andrew, you talk about this all the time, reducing processed sugars, fat, protein, and fiber at each meal, making sure you're having enough fiber, having enough protein, having enough healthy fat. All of that's going to help support a healthy metabolism, healthy elimination, healthy blood sugar balance.
I love these. So the recap is essentially stress. So stress management, which to me is always going to be number one, because you can do all these other things, but if that's not, it's off, right? Managing the blood sugar, making sure that you've got your balanced diet and that you have adequate proteins, and essentially that you're eating those essential micronutrients, the vitamins and the minerals that people need to be able to make those hormones, which is really important. And these things, ladies, seem relatively simple, but the thing is we've become accustomed, like Denise says, especially here in the Western world, for those of you tuning in here, of we're eating a lot of refined stuff. We have foods and plastics that have higher amounts of estrogen in it, and we're put at a disadvantage compared to other places that don't have the accessibility to these things. And it wasn't actually something that I had considered, but now that you've talked about it, I'm actually going to start looking at other cultures to see if I can find any information on the difference, because that is really
there's certain
crazy.
cultures that don't have the same. They're like, what's menopause? Like, they know menopause is a sense, obviously, women's stop cycling, but not in the same way that we think of menopause. Like, we think of like, oh my gosh, I'm gonna feel horrible. Like, they have this like doom and gloom, right? But they don't have those same experiences. And another one too that I like to point out too is to reduce like the processed sugar intake, but like also to like sweeteners. Those are a big one. Sweeteners and aspartame. So any, like, again, small change, huge impact. That will really affect how your blood sugar is being balanced, your insulin levels. Those are all really important.
Nice.
Tips.
That is going to be our slogan for today's episode. Small change, huge impact. I love it. That is huge. And honestly, I appreciate you hopping on with us and sharing your wealth of knowledge. I mean, you have been a phenomenal resource for me, a phenomenal resource for my clients, but also too, you really come from a place of care. Like, I see all of the ladies that you've worked with, and I've had the pleasure of obviously, like, knowing you in business, knowing you as a person. Like, you truly care, and I feel like practitioners, if you're coming from a place of care, like, any advice you're going to give is gold. So thank you so much for your time. It was phenomenal.
Yeah, thank you, Andrew, for having me. I was really excited to be on your
No worries.
podcast.
I'm excited. So excellent. Well, that is all for this episode. Thanks everyone to tuning into the Hormone Helper podcast. Thank you so much, Dr. Denise, for coming on with us. And remember, guys, make sure that you subscribe to stay on top of each new episode. Remember, the greatest form of compliment is a review for both me and, of course, Mrs. Denise. And if you're in need of a naturopathic doctor, you can find Miss Denise and her team on at Abaton Integrative Medicine for Instagram, or for your Facebook folks, you can search for Abaton Integrative Medicine, and their group is there. So I will drop the information below in the show notes. That way you can find her. And any questions that you have, we'll leave our contact details. Feel free to reach out to me, reach out to her. We will make sure that you guys get the best help and support. But thank you so much for listening. Well, it seems I'm all out of info juice for today. That's all for this episode, and thank you so much for listening. Please leave a raving review for me if you've learned something good, and make sure to subscribe to the podcast so you don't miss an episode. Now, if you're in the mood for some more great content and tools to get your hormones on track, why not check out our free Facebook group and the blog on our site. We do amazing weekly trainings in our group that me and my wife call Tea and Teachings, that give good tips for anything hormones and metabolism related. It's also a great community where you get to share your goals and success with like-minded people just like you. I'll make sure to drop both the Facebook group link and the blog link in the show notes for you. Or if you're ambitious like me, the name of the group is Weight Loss and Balanced Hormones. It'll say Fit for All beside it with a picture of me. So come and join us and have more fun.